Okay, so the modern phase of public health, where we're looking at the emergence of chronic non communicable diseases. So NCDs is the abbreviation. You'll see this non communicable diseases. You'll see this acronym used quite a bit. But it was the beginning of the 18th century, so the 1700s, where we start to see the increase in chronic disease, or NCD, chronic disease or non-communicable diseases. Um, and we're talking mainly about Europe in this sense, Europe and the United States, because in many countries, it's still, in developing countries, it still hasn't begun. So this epidemiological transition is what that's called. Um, and essentially, whilst we can observe this phenomenon in terms of disease rates, it's essentially a question of moving from poverty to affluence. And there, the whole process of what's called epidemiological transition is associated with a move from a prevalence of higher prevalence of communicable disease to non-communicable disease. Um, and it basically changes the mix of health issues that particular health systems have to deal with. If we look at the range of influences that were happening at the periphery of this process of development of public health, these phenomena are actually quite um, instructive in terms of our understanding of health and disease, understandings of health and disease. So, if we look at the historical texts, we can see that you might have heard of Hippocrates, the Hippocratic Oath. Hippocrates was a physician in ancient Greek times, and um, 5th century BC, quite a long time ago, and even earlier with the ancient Egyptians, were starting to document um, health um, health findings, health observations, and in fact, the Chinese were also instrumental in this. European history tends to overlook the contributions of the Chinese, but in the 10th century AD, there were texts for medical and health writings in Arabic. The Greeks through the 11th century. Um, Through the 12th century, I mentioned before, you'll remember a couple of slides ago, talking about bubonic plague, but also leprosy was another one of these mysterious diseases. Leprosy is caused by a mycobacterium, just as tuberculosis is caused by a mycobacterium. It's a related bacterium. Um, and during these times in the 1300s, so the Middle Ages, there were vast plagues of people who died because of this. But at that time, also, if we're looking at parallel developments that affect the public health system, there was a move towards formal education for medical practitioners, so laws were introduced. And looking at the scientific developments of this time, there was also very organized analyses of the human body in terms of anatomy and dissection to try to understand the functioning of the human body. Now, the development of the printing press in the 14th century is actually quite instrumental in medicine for communicating knowledge, because it was very much a process of democratization of information, although in fact there is still fairly low literacy rates, so books were still the domain of the wealthy. But in conjunction with this, in fact, is the printing press was instrumental for communication of medical knowledge, but it was also instrumental for communication of agricultural knowledge, and it had a big impact on food production because appropriate agricultural techniques were more easily communicated by books. Then further along in the 15th century, Leonardo da Vinci is well known for his anatomical drawings. William Harvey, discovery of how blood circulates around the body. So you can see here that a better and better understanding of how the body works led to a more insightful idea about how to prevent disease. If we look now further into the 1800s and 19th century, some very instrumental discoveries happened which really had a big influence on public health, health promotion, and the management of disease and plagues, epidemics. So Robert Koch discovered germs. Louis Pasteur discovered the process of contamination. There's the discovery of the cause of gonorrhea. Koch discovered the cause of tuberculosis, and then there were other diseases, the causative agents of typhus, diphtheria, and tetanus. And also the plague bacillus was identified, as well as parasitic disease caused by trypanosoma. Trypanosoma, which is sleeping sickness, was discovered in Africa. It's called African sleeping sickness. Dysentery, the basis for dysentery, and also the bacterium treponema, which is the causative agent of syphilis. So we can start to get a picture now of the fact that if we look at the process of development of health problems throughout the ages and the solutions that were found, there was a very clear parallel process of development of technology and understanding of health and how the human body worked. And if we're looking for some overarching statements about why we've come to the situation where our prevalence rates, premature mortality rates have gone down over time. So if these are the prevalence rates going up the y-axis, and the x-axis is time. Over a period of time, our prevalence rates for premature mortality have gone down. Now, there's a few global developments. Firstly, the improvement in nutrition. Since about 1700, nutrition has been one of the major contributors to a reduction in disease prevalence, communicable disease prevalence. And at least 20% of the reduction of the death rate by the mid-19th century is due to hygiene. So just a simple measure of being able to manage sewage properly and various hand washing techniques stopping germ transmission has been quite instrumental. So the development in the 20th century has been the science of immunology and immunization, and that is said to have had a substantial effect on disease rates, on death rates. But this is in combination, so vaccines in combination with antibiotics. So antibiotics were not available particularly widely until after the Second World War, but the sulfonamides in 1935 were the first antibiotics. So nutrition, vaccines, and antibiotics were substantially the basis for these improvements in prevalence rates. So these improvements in prevalence rate, that is the reduction of disease prevalence over time. And then following on from that, the reduction in birth rates due to the oral contraceptive pill have also, they also were very instrumental in terms of maximizing these benefits up here, because disease rates were reduced and the population expansion was curbed to a certain extent, so that the benefits were enjoyed, were not diluted by larger populations. Now, so with all the scientific technology that's developed in terms of medical science over the last 3-4 centuries, it's nutrition and hygiene which are particularly prevalent, certainly in the 18th century. So if we look at the environment, so if we group together the nutrition and hygiene as environmental factors, they were particularly important in the 18th century. Then the way people behaved in terms of avoiding unhealthful situations and promoting health. This was particularly important in the 19th century. Now in the 20th century, last century, it was the therapeutic time. So antibiotics and various other pharmaceutical drug treatments, which have led to the substantial impacts on health, public health, that we've seen over these last 3 centuries.